Ah, now the broadcast is live. Hello, everybody. I'm Dr. Margaret Rutherford, if you want to know my last name. And once again, we are here on Mental Health on the Mighty on a Wednesday and a Facebook Live. As I've said many, many times, this is one of my very favorite things I do every month. It's usually on the third Wednesday of the month. And I have a wonderful woman I work with, Rowan, who helps me, and she's absolutely fantastic. And we picked something for today that I hope, hey, Monica, um, that I hope will be. It's not as structured a conversation as sometimes we have, but I really wanted to pick your brain and let you pick mine. And we're going to kind of talk about the difference between transitory or temporary self care. Hey, Anne, it's good to see you. In fact, Anne, I got the idea to do this from something that you posted in our Facebook group, which was, in fact, I looked for it earlier and I couldn't find it, but it was this beautiful posting about what exactly is self care. Hi, Jessica. And I thought that, wow, that would be a really good thing to talk about because this post was all about, the grittiness of real self care, the things that maybe you don't want to do or you don't even see as self care being self care. So that's what I wanted to talk about. Hi, Connie. Good to see you. Gosh, I'm getting regulars. Hey, Sydney. Hi, everybody. This is boring self care, right? And it's very boring. Yeah, it's. I went out for my walk in the incredible humidity here in Arkansas this morning, and I was just dripping when I came back. And I thought, ugh, this is a lot more pleasant in the fall when the leaves are turning and it's 60 degrees, but anyway, so we're going to be talking. Hey, Jason, you're new here. Well, welcome. You can add a little bit of freshness. All these oldies but goodies that are here. I'm delighted to have you, and so glad you've tuned in. About me, and those of you who know me well, you have heard this ad nauseum, but I've been a psychologist since 1993. So that's a long time. And actually started seeing my first patient in graduate school, and that was 1988. And I pray I did him no harm. His name was Kirk. I'll never forget him. But anyway, I have been delighted. This is my second career. I was a singer, professional singer before, and this has been a wonderful avenue for me to grow as a person and to get to meet all of you. And then I started blogging in 2012 at drmargaretrutherford.com. I actually started a blog about empty nest because I was going through that. Hi, Nina, new as well. Perfect. So glad you're here. And that was called Nest Ache, Nestache. That is no longer with us, although you can find my empty nest post on my own website, which is drmargaretrutherford.com. And I loved writing about that, but I got kind of bored with it. I've told my son I'm kind of over you, which of course I'm not. But I decided that I really wanted to write more about mental health. So that's what I started doing. Again, at drmargaretrutherford.com. And thus far, gosh, we've been revamping posts for a year and a half, and there are hundreds of them. So, and then in 2016, I started podcasting, and my podcast is called the Self Work Podcast with Dr. Margaret Rutherford. Hello, John. John Walker, what a great name. There was a doctor named Dr. John Walker when I was a little girl. You're welcome. I love being here. Love being here. Oh, Jamie, you're going through empty nest. I'll have to tell y'all a story about my son went to Vandy in Nashville, and I had made the mistake of, he's my only son, I'd made the mistake of not working the next day. So we drove back and I was kind of a mess, but then I thought, okay, I'm going to, clean house and I'm going to do all this stuff. Well, I found myself out in his car. He had been accepted to the University of Arkansas with full honors, and he decided not to go, which is understandable. It would be like in his backyard. So he went to Vandy, and I was just sobbing in the front seat. I've changed my mind. You have to come back to Fable. I was just so upset. And I looked up, a neighbor of mine was walking by and was pretty close. And she kind of looked over at me like, what is going on with you? And I got really embarrassed and I went inside the house and I found this picture, or it found me, I think it found me, of I have 4 nephews, all are much older than my son, so they ranged from, like, 18 to 13 when this picture was taken, or 19, and Rob was, like, 2, and so my son, and so I looked at all those my nephews, and I thought, I never had any problem with them becoming men and leaving home, and so I did my sniffles, and I thought, "Okay, I've got to, get my life together," and doing this is part of all that. Um, okay, having terrible withdrawal symptoms, having a terrible time, I guess, with empty nest. Yeah, it's hard, but it does get better. In fact, if you want to, um, well, no, that's not on that exactly. Just go to my website at drmargaretrutherford.com and search for empty nest, and you'll find a lot of my writings there that hopefully will be helpful to you. Linda, I'm going through anxiety and panic disorder. Have you any tips, please? Well, Linda, I have panic disorder. I started having panic attacks in my late 20s. And so, I love the work by Reed Wilson. He talks a lot about not only understanding your panic, but leaning into it and actually naming it. Actually, if you want to go to my website, I've written a good deal about it, and that might be helpful to you. Jason, you're here because of clinical depression, severe withdrawal from meds, Maxine. Oh, well, I'm not a psychiatrist, so I can't help you too much with that. Clinical depression, severe anxiety, and PTSD patient. Mental health sucks. 18 medications each day. I think you mean mental illness sucks. Um, Hopefully mental health doesn't, but I mean, that's a lot on your plate, Jason. So I'm really glad you're here. So anyway, that's kind of my life history and then about almost 5 years ago now, Mental Health on the Mighty asked me to do a thing. I also written a book called Perfectly Hidden Depression, and they asked me to come speak about that. And that was in October of something. And then ever since then, I've been doing once a month on Mental Health on the Mighty. So let's see, Mariana, false comfort, worried mind, and wise mind. I'm barely learning these, but also doing my best to self care and be assertive about it. It can be challenging. You bet it can. Those are DBT terms. Wise mind, I know, is a DBT term. It's dialectical behavior therapy, and that's really geared toward helping people whose emotions kind of run away with them. Uh, Psychologies for that is emotional dysregulation, and they really help you try to label those things so you get more of a grip on it. But let's move a little bit. Maxine, I'm sorry I can't hear you. I can't help you. Again, I'm not an MD, so that's out of my licensure and out of my purview. I know it can take some time though. So we're going to talk about the difference between what is real self-care or actual self-care and what it looks like, and then what is more what I would term either self-indulgence or comfort, or either just some short-term things that you are really trying to focus on to help yourself with whatever mental illness you have. Now, obviously, this is a wide audience, and we could be dealing with anything from CPTSD to panic attacks to schizophrenia, and so the breadth of all those kind of diagnostic labels are huge here. But basically, I think a lot of times we get confused when we're reading articles and they give us the best self care, and you know they talk about massages and Botox or something like that. And I just shake my head when I read those things because those are truly not true self-care. They are if you have body image issues or body dysmorphia, Botox may help you. If you have migraines, Botox may help you. Massages, I'm getting a massage this afternoon. I have degenerative disc disease, and boy, Heidi, does massage help me a lot. You betcha. So I realize it's not totally it's not frivolous. I mean, they're very, very, that kind of body work is very, very helpful. But some people treat it like this will solve my problem if I do this. And so, uh, basically, I think that, you know, I'm a potato chip. When I need comfort, I need salt and I need carbs. Um, and I knew I'd married the right man when I went through infertility treatment, and my husband was coming down the hall of the house we lived in, and you could see straight from the living room to the den. And I was in the den, and he had just gotten home from work, and he was looking at me, and I had finished the whole huge bag of potato chips. And I was kind of down at that part where, you're licking your fingers and trying to get the bottom of the potato chips. And I think I also had a screwdriver in front of me, to be perfectly honest. And I mean, I'll come to your questions, but anyway, and all he did was look at me and say, "Do you want me to get another one?" And I knew I'd married the right. I didn't know if he meant a screwdriver or potato chips, but I think he meant potato chips. So we all need comfort from time to time, and I'm not knocking that. Let me see. Sheila Penny, you say something about a second opinion. Actually, a second opinion is on my list for self-care. Um, I think seeking a second opinion sometimes, especially when you're on a lot of medications or you have a lot of diagnoses. The literature will tell you, research will tell you that you have the same symptoms, and you go to one therapist or psychologist or psychiatrist, and they will designate you having one kind of problem. You go to another psychiatrist or psychologist or social worker or LPC or whomever you're seeing, and they will give you a diagnosis of something else. Part of that is because there's a lot of overlap between many, many diagnoses. Okay. So it's a little bit subjective to know where they're going to hear, for example, if you have racing thoughts, well, that's part of mania or hypomania in bipolar disorder. But there are also some personality disorders. You can also, when you have anxiety, you can have racing thoughts. So, what exactly is it? And so that's why a lot of people accrue many different diagnoses, and because they may have been in one setting and got one, and they just never drop it. So I find that psychiatric hospitals, certain ones, are really bad about, you walk out there with 6 diagnoses rather than anything having really truly being the focus of treatment. So here, Claudia, my best friend suffers from bipolar disorder and has started a new job. The problem is he thinks he isn't good enough for this job as he suffers from brain fog and memory loss. So how can I assist him to help him with the subject self-care? Okay. So he has bipolar disorder and he's still suffering from brain fog and memory loss. Well, basically, I think it would be good self-care for him to go to either a neuropsychologist or to a neurologist, because bipolar disorder does not inherently include, certainly not, memory loss. And so that might be something else, or it might be a focusing problem rather than any kind of memory problem. It could be really problems with focus. Now, bipolar disorder can actually, because you're going up and down a lot, can help you. It can prevent focus, but you can do things like have neurofeedback. You can have different kinds of uh, treatment for focusing issues. He could have an attention deficit disorder. So I would make sure he's going to a really good psychiatrist who he can, not just have someone else who's not a psychiatrist, not a medical doctor, diagnosing with bipolar disorder, because that could be perhaps not enough. So getting a second opinion is actually on my list of good self-care, because you want to make sure you're getting the appropriate diagnoses. And I know people, just like with medical doctors, you want to walk into a medical doctor's office and you're going to walk out knowing what's wrong with you. Exactly, right? Like, I have bronchitis, or I have pneumonia, or I have a respiratory infection, or I have, there's a block, I have a tumor in my lung. I mean, you want to know what's wrong, right? And sometimes it takes time for that to really occur, and other times there's going to be disagreement between what's truly wrong with you, or you need more testing or whatever. Now, in mental health, we don't have as specific a test as sometimes medical doctors do, so we're a little more dependent on subjective kinds of criteria. um, but as much as we'd love to think they're totally objective, they are not. They're not. And there are diagnoses that come and go in the diagnostic manual. So, like if I diagnosed you with a schizoaffective disorder for a certain number of years, and then you went and said, "Oh, I have schizoaffective disorder." Oh, well, that's no longer in the DSM, the Diagnostic and Statistical Manual. So you must not have that anymore, right? Well, that's stupid. So, a lot of times, diagnoses come and go too, or they morph into something else. So, for example, PTSD got moved uh, from an anxiety disorder to a trauma disorder recently, or in this last version of the DSM. So, people's ideas about it are changing. Okay. Good evening from the UK. Hello. Um, Mariana, worthiness versus worthlessness, knowing difference for self-care. No expert here, but knowing your worth and wants, not your worth. Try my best to describe it, not confusing with self-care. Well, I think what you're saying is that that self-care has to do with how worthy you feel of it, right? And so, if you are ashamed of having a mental illness, and I certainly used to be ashamed of having panic disorder. I didn't want anyone to know. It wasn't my MO. I thought people would think less of me if I had it. I didn't want anybody to know any of that kind of stuff about me. So, I understand that and have a great deal of empathy for it. However, I do think that if you feel like you are worth that kind of care, like I said, I went out and walked this morning because I have degenerative disc disease. And if I do not, and I sit for a living, I sit while I work, then I'm in big trouble. So part of my self-care regime, and I'm always can tell when I'm not doing as well with that, is I don't walk. That it's very much a self-worth. And I think that's what you're trying to say. It's a good point, really good point. Joel, how would you suggest someone go about getting the most out of therapy? I want to get better, but I'm not sure how to get the best use of the time I have with my therapist. Great question, and actually a pretty good self-care question. I can't tell you how many people will tell me, "Oh yeah, I've been in therapy with this person for a long time, and I kind of want to leave, but I feel like, you know, it would hurt her feelings if I left," or something like that. Or they'll say, "Yeah, he talks more about himself than he does me, but I've just been going to him for so long." I mean, it's just bizarre to me. I mean, if your plumber doesn't fix your plumbing, you now again, it's not as cut and dried with mental health, but you wouldn't use the plumber anymore. You wouldn't say, "Oh, that would hurt his feelings or her feelings or their feelings." So, I think you have to be kind of pragmatic about it. Um, I think, Joel, what I would suggest is you have to know the kind of focus you want to have. If you if you want someone to listen to you and you feel really supported because you were listened to, that's a certain kind of therapy. It's more of a reflective listening kind of therapy. But if you want a very goal directed therapy, if you want something like in 3 months, excuse me, I've just taken a big thing of iced tea and I keep burping a little bit. Sorry. I hate that word burp. Anyway, so if you have a very goal directed sense of yourself, that in a month I'd like to be able to do this, in 3 months I want to be able to confront my perpetrator, or I want to reconcile the conflict I have with my brother, or I want to approach my wife and tell her I really think we need couples therapy, or whatever it is that you want. Not all therapists are real goal directed. Okay, so some of them are more technique oriented, like a DBT therapist, like a CBT therapist. Although cognitive behavioral really talks a lot about the rules you're following and what your beliefs are and how they are affecting what you do. If you have trauma in your life, then you need to be with a therapist that really knows trauma. She or he has gotten, or they have gotten training in trauma. They've gotten training in EMDR. They've gotten training in neurofeedback. They've gotten training in just traditional trauma work. But they can look at you and say, I've been with other people who are in the same position you are. So you have to really make sure your therapist is a good fit for you, not just that you like them, but is what they have to offer you a good fit for what you need. Okay? I hope that's helpful. Oh, Sheila, thank you. I'm so happy people are starting to take mental issues seriously. Thank you for doing this podcast. Isn't it wonderful? I mean, I do think that it's getting much more airtime and playtime. I'm glad celebrities have been talking about it. That will help. Obviously, athletes are talking about it. Um, and there are therapists out there who are being much more transparent about their own problems, me being one of them. And just I think as I know, I have a 26 almost 27-year-old son, and I know in his generation, in millennial generation and younger, they are seeking therapy very openly, and they're talking about their mental health. Like, they recognize that it was not okay for their dad to be an alcoholic or to be really depressed and take it out on everybody. They've lived through that. They've lived through, no, we don't talk about this, and they want something different. I think that's fantastic. Caroline, can you overcome depression and anxiety, trauma triggers through therapy, etc., or do you just learn to respond differently? Um, well, I think therapy can help you identify what are your triggers, but that doesn't mean that you can figure all that out in an office. So let's talk about some of these more long-term self-care, because it really fits in with your question. Basically, when you do more long-term self-care, you're talking about really in your case, Caroline, it would be, what are my triggers? And I want to start managing these triggers. You can know your triggers. You can say, I always know if I don't get enough rest, or don't get enough sleep, that I get manic or I get depressed. But unless you start managing your sleep schedule, that's good self-care, long-term self-care. And that takes practice outside of the therapy session. Therapy, now there are some therapists, behavioral therapists, that if you have like OCD or something, will actually go on site, and what you're scared of, they will help you get through. Like if you're scared of germs, they'll have you stick your hands, when it's time, into a garbage dump or something. And they'll be there with you and help you calm down. But that's behavioral therapy, and is very specific to certain kinds of mental health issues like OCD or like phobias. So um, I think that so it's a combination of work in therapy and then practice outside of therapy. Sometimes when I have someone as a patient that just is simply not doing, they just, either they're couples or they're individuals that think just being in therapy, I'll sometimes have to say to myself, I can't want them to get better any more than they are willing to work on it. And so I can make all the suggestions and assignments and homework and all this kind of thing. But if they don't do it, then they're not going to be able to experience something in their own life rather than just in the therapy room. Um, Melissa, have I ever struggled with mental health? You betcha. Like I said, I have panic attacks. I had full-blown anorexia in college, and I still have eating disordered thinking, meaning I still really struggle with my body image, and tend to think that I'm more. I weigh. I tend to think that I look fatter than I really do. I'm very self-conscious when I gain weight. And so I really struggle with the eating disordered thinking in general. I was laughing with camera. It's a real success for me to wear something that is sleeveless today, and I challenge myself like that all the time. And that's part of my eating disordered thinking. So yeah, I have struggled, and I've been divorced twice. I've been married for 31 years now, but I went through a very, very chaotic period where I dealt with a lot of depression and anxiety, and just I made a mess of things. Mariana, our worth is not our productivity. um, Wanting to find something neutral with this. I think of this as both an answer, but wanting to find the why not to it and hopefully find some neutrality in it, connection to self care. Thank you for helping with answering the previous questions. No, I don't think our worth is our productivity. There was an American actor named Christopher Reeves, Christopher Reeves, who played Superman, and he was this built, uh, probably worked out all the time. I mean, he was a very handsome man. He was very athletic, and I mean, he could play Superman, with no help in the costume. And he was in a terrible horse accident, and he became a multiplegic, or he became paralyzed from the neck down. And I've never read the book myself, but I've heard that in the book that he wrote later, that he begged his doctors to let him die because he could see absolutely no worth to his life if he couldn't do for his family, for his community, if he couldn't act anymore, if he couldn't hug his children. He saw absolutely no hope. And he went through a severe depression. Now, that's obviously a very, very dramatic case. He found his way. He actually made a lot of money for people who have brainstem injuries like he did. And so I think finding your worth outside of your productivity is very important. And of course, gets even more important the older you get, because I'm 66 and I can't do what I could do at 46, at 66. And so if I still was struggling with the fact that, I can't, uh, I mean, I'm just not as well. I mean, I'm more productive in some ways, but I'm much less energetic in others. And if I were hung up on the idea that my worth had to do with how much I produced, then I would be in trouble. So I think that's something you can learn in certain families and certain cultures, that you have to keep doing to make sure your worth is viable. But I don't believe that. Okay. Okay, so let me read off some of these, what I would call long-term self-care, that I just literally wrote down this morning. Reconciling conflict. Not all conflict is reconcilable. I completely understand that there's estrangement happens for a reason, and sometimes one or both parties simply will not recognize their own responsibility. But when you can reconcile conflict and you can build a greater support system for yourself, that is long-term self-care. Being more organized. Now, some of us are more organized than others, but if you are living in really a mess and a lot of clutter, and the message to you is, I don't care enough about myself to clean off even the top of this desk. And so your surroundings really can begin to suggest how you feel about yourself. So good self-care is, I mean, I am not a clean freak at all. Anybody who's been in my office and sees my desks know that I have piles of this and piles of that. I know what's in the piles, but basically the piles are fairly neat. Okay, so you really, how your environment is often gives you the message about whether you're worthy or not. So I'm hoping that sometimes, again, get some help if you have a friend that organizes things a lot better than you do, and get some help. You can join support groups just like the Mighty. That's why you're here. I think that would be really a great idea. Looking at how you might be drawn toward chaos. I had to do this work in my 20s. I was incredibly drawn toward chaos, and I really had to look at that very carefully. Identifying your strengths, being proactive in therapy, doing the dirty work, as Ann Doss said just a few minutes ago, doing the boring stuff. It's not fun to clean out a drawer. It's not fun to take out the trash. It's not fun to mow your lawn. It's just not fun to do that stuff. But when you make yourself do it, you'll look around and go, I feel better about myself somehow. Not taking relationships for granted, showing gratitude, being kind, learning self-compassion. That's a long-term self-care thing. I had a family member I was talking to yesterday who's going to be going through a divorce, and I said something about, you're going to have to, or certainly my suggestion would be that you're going to have to show yourself the compassion that you've shown others. And they looked at me and said, I don't know if I can do that. And so I'm going to keep on suggesting that very thing to them, because we've got to have compassion for ourselves just as much as we have other people. It's good self-care. It's not feeling sorry for yourself. It's not self-pity. It's self-compassion. It's understanding there are reasons why you struggle with what you struggle with. There are reasons why your strengths are your strengths. And it's about acknowledging those things. Financial planning is part of long-term self-care. I don't care if you have $10, you have $100, you have $1,000. Knowing and planning your finances. How many people have I talked? In fact, I didn't take credit cards for years because I learned, that people's credit was in horrible shape 6 months into their treatment. And I thought, I can't let them use their credit card. I will be actually aiding and abetting what is their problem. But again, going to a free, there are plenty of free financial services, and letting someone help you get your finances in order, that can be so important. And legal issues as well. I think that's another kind of one of those boring things, but I've known people who never gotten divorced and they haven't lived together for years and there's no really good reason, or they have outstanding warrants for their arrest, and they just live under this cloud of, one of these days I'm going to be pulled over and I'm going to be, slammed in jail. And so, you can go to a legal services for free, and get some help. So let me look at some of these questions. Thank you so much for opening up as a mental health professional about your mental health struggles. I feel as a mental health professional, this is a continuous struggle to admit and be transparent about. It was super comforting to hear your authenticity. Thank you. I can tell you I've not always been this transparent. And yet it has been a wonderful gift to give myself. Um, Brene Brown, who we've already talked about, talks a lot about, when you admit your vulnerabilities, when you admit the things and are transparent about those things you struggle with, no one can really use it against you anymore. If someone wrote in the newspaper, well, I'd never go to Margaret Rutherford as a psychologist because she's been divorced twice. I go, yeah, you're right. I have been. That's pretty bad. I mean, I've had a chaotic decade there. And so it's certainly, you're right, not want to come to me, but I learned a hell of a lot during that period of time. So, um, that's just, now I don't share all of that all the time with my patients. That's not going to be helpful. The session is all about them, and only if I see a particular instance where I think it'd be very helpful. Now, since a lot of them, read my blogs and listen to my podcast, they know these things, but I don't bring them up in therapy. It's so important to, why is it so hard to have self-compassion though? Well, and Jason, I see your question too. Um, I think we get it mixed up with self-pity, and this kind of addresses Mariana's question too. Still, in the United States, there are certain areas of the country, and I know there are other cultures. There are many cultures where you just you just keep the thumb in your back and you never complain and you rub some dirt in it, and that's what's seen as the American way, or maybe some other culture's way. You just I had several African American patients last year, and a couple of them said, our mothers and fathers didn't tell us it was okay to have self compassion. They said, you're black and you got to handle it, and you got to um, you've got to fight through it, and never show anybody your weak side. And so, that was their reality. And I'm sure there are other minorities that this cultures feel the same way. And I'm not an expert, and certainly I'm obviously very white, so that didn't happen to me. But anyway, that certainly can happen in other cultures. Um, Let me see. Let me go up to Jason's. Having PTSD, and even though I to sleep better and having PTSD, and sometimes it's impossible. Thank you. Um, Well, what I might suggest, Jason, is that you talk to your therapist about some things like neurofeedback or EMDR, whatever you have PTSD about, obviously is intruding upon your sleep. And there are ways to help you with that are these newer techniques other than just talk therapy. So you might want to get the book The Body Keeps the Score, which is a wonderful book about post-traumatic stress and these body treatments. Yoga can be very helpful. I know they go, oh, yoga, but it's been proven to be very helpful. Meditation can be very helpful. So I would get the book The Body Keeps the Score by Bessel van der Kolk. Sydney, I believe that each individual was born with their worth, and our self-esteem should be influenced by that knowledge that every person has worth. Amen. However, often people let others, ourselves, and our expectations influence our self-esteem more than it should. Been there, done that. Individually, we determine or guide how we feel about our self-esteem, but our worth, I think, is unchangeable because we are human. We have worth no matter who we are, how we look, or what we do. It's beautifully put, Sydney. Beautifully put. And there are people who struggle with that. Um, there are people who struggle so much with shame, which is not, it's not guilt about you have remorse for what you do. Shame is, I feel so bad about mistakes I've made or or the fact I have mental illness or that I drove the car and my friend was killed while I was driving, or um, I didn't save our dog from a tornado. I mean, it could be all kinds of things. I'm not making fun of anything. Um, you can carry shame around forever. And so learning and shame robs anyone of truly feeling like they have self-worth, because shame is about thinking you're a bad person, you're an unworthy person because you did that or you didn't do that. Okay? And what I've learned, if I've learned anything as a therapist, we all think, oh, I know what I'd do in that situation. I'd run in and get the person out of the fire. Or and no, you don't. You might be paralyzed. You might be the hero or the heroine and run in and do that. But you really don't know what you're going to do. And often when we don't do what we think we were going to do, then then here comes the shame. I was in a very abusive marriage. And so, looking back on it, I can think, well, why didn't I see that? Why didn't I get out of that relationship? Years before we ever married, he'd been abusive to me. But I didn't have that wisdom and I had a lot of shame. Okay. Carolyn, this is you're new. I really struggle with self-worth. Coping strategy rely on others. Coping strategy, I rely on others. Despite working on it, I find it really hard to break this cycle. Okay, well, this is what I'd have you do, Caroline or Carolyn. Before you reach out, I don't think there's anything wrong necessarily or overly pathological by relying on others. If you're relying on their affirmation, well, okay, let me say what I'm going to say. Often when I hear this from someone, I say, okay, so before you text the person that you're needing to hear them say, oh, you're fine, or you're good, or you're great, or it's okay, ask yourself this: what do what do I think they can give me that I cannot give myself? What do I think they can give me that I'm struggling to give myself? And then wait for a second and think, what would I have to do to give it to myself? Can I look in the mirror and go, it's okay for you to feel angry, or it's okay if you're sad. It's okay if you're afraid. It's okay if you're happy. What's getting in my way of giving myself affirmation for the way I feel? And my guess is that comes from a long time ago when you somehow learned that you needed to discount your own feelings or they weren't important. Parents can also sometimes inadvertently or sometimes intentionally give their children the idea that you need me to be okay. You need me. You're not going to be okay if I'm not in your life. And so they will promote the dependence rather than you saying, I can do this myself. At least I'm going to sometimes ask for help, but I also can do this myself. All right. Let's see. Tracy says, I think it's also because of how we're taught about emotions. Yeah. Yeah. Especially here in the United States. And I think uh, in many other countries, we do joy, we do celebration, we do all the wonderful feelings. We're just fine with those happiness, pride. But when it comes to sadness or loneliness or despair, um, we don't know what to do with that quite as much. And so I really think that is. That's I'm hoping the younger generations are going to help the older generations with that. My own grandmother, when she found out I was going to be a therapist, said, "Why would you do that? That's just people feeling sorry for themselves." And I looked at her and I said, I've been in therapy many, many years, and it's not because I'm feeling sorry for myself. I had a lot to learn. So, um, you know, with time and with more people being open about it and transparent about what they struggle with, and hopefully we'll all help one another. Okay. And Jason, I'm glad I've been helpful. Again, I will be back the third Wednesday of what we're in June, so the third Wednesday of July, which I have no idea what that date is, but at 3 o'clock p.m. Central Standard Time. I hope that um, you'll be back. Tracy, I've been working on addressing and recognizing limited thinking and limited beliefs. Good for you. Good for you. That's exactly what I'm talking about. My limited belief that I only can do X, Y, and Z for myself, and yet maybe I can do more. And when do I really want and need and would benefit from looking for help from somebody else? Great insight. So thank y'all all so very much. I'm Dr. Margaret Rutherford. My website is drmargaretrutherford.com. My book is called Perfectly Hidden Depression, and it's not only for perfectionists. It's for anyone who's trying to control their access to their painful feelings. They're leading a very controlled looking life. A lot of people who are actually perfectionists don't even see themselves as perfectionists, but it's with you're on that treadmill all the time. I've got to meet this expectation and that expectation and the next expectation and the next expectation. And then pretty soon you've lost sight of really your own pain. And that can be deadly. So it's called Perfectly Hidden Depression. It's an ebook, audiobook, and paperback at Amazon or wherever you buy books. I also have the Self Work podcast, and I did a course on depression called Facing Depression. That's on a whole bunch of different kinds of depression, and that's at Himalaya.com/depression. If you want to take that up, look at that. You actually have, I think, a week or two as a free trial, so that might be helpful for you. Um, and what else? That's it. That's enough selling myself. All right. Thank y'all so much. And I'll see you in July, third Wednesday of July. So see you then. Y'all take